This morning on BRN, managing healthcare costs in retirement, part 2 of our conversation. And we're going to welcome back to the program Alicia Hartjen of SS&C Technologies and Ron Mastrogiovanni of Healthview Services. Ron, Alicia, welcome back to the program. So great to have you back this morning. Alicia, Ron, so great to see you again. Thanks again for joining us for part 2 of our conversation this morning.
Thank you.
Yeah, Ron, we had a great conversation yesterday. And look, there is such a pressing need for this, to get ahead, to be proactive instead of reactive. What types of solutions are out there that clients are implementing to help manage this convergence of wealth, health, and retirement?
Yeah, we're finding that today, when we look at the comprehensive planning systems, they are integrating healthcare costs today, which is really important. And in addition to healthcare costs, they're also including actuarial-based life expectancy, because that impacts everything across the board, especially for people over the age of 60, where the vast majority, 95%, have at least one chronic condition. Just to give you an example, traditionally, we plan to 95. That's what we've done in the industry, but very few people get there. So the question becomes, if you provide someone with the actuarial number, they may, let's say the actuarial number is 80, right? They may still decide to plan to 85 just to cover themselves to be more conservative, but they're making the decision based on actuarial reality. And what we've found is more people are willing to actually take action, which is very important. And now they're including healthcare, and you find that when people see what these healthcare costs are, and based upon our conversation yesterday, those numbers are dramatic. And what's interesting is people want to take action. They want to take it off the table, and it becomes an important part of the planning process.
Yeah, it kind of provides that. I don't want to sound macabre, but it kind of provides that end date. It's kind of a wake up call. Like, okay, you got to do some planning and you got to be prepared. So Ron, just to kind of follow up on that, if we have lots of financial advisors and other people in the retirement ecosystem watching. So where do they get started? Where does someone get started to be able to provide this data, provide information, and actually guide clients through this process?
Of course, we provide the data and the applications that make the projections, and there are other firms that do that as well. But what's important here is for advisors not to use generic numbers. It is really important not to do that, because the type of coverage makes a big difference. Someone's gender, their current age, their health conditions, and this a lot of people find surprising. The state they live in. I'll give you an example. If you look at a supplemental policy, and that's provided by private health insurance companies. If you're in my state and you have the top policy, you're paying 50% more than purchasing the exact same policy, exactly the same. I'll go as far west as I can to Hawaii, in Hawaii. So the cost in Massachusetts will be 50% more than Hawaii for the exact same policy. So do not use generic numbers. You want specific numbers related to the person's background, where they live, their health conditions, and life expectancy. That's actuarial based. Once you have that, you can integrate that into current systems. And that's what firms are doing today. They're integrating all of that. And in some cases, you can run it separately as an independent application. Surprisingly enough, people like that. It's quick and it generates the numbers they need, and they can easily determine how to save for it, which becomes important. And by the way, there are a lot of options on the savings side, whether it be insurance products, traditional wealth management products. Those are all available.
Yeah, really important. And Alicia, we've talked to you. This next question I want to direct to you, because we've talked about this on the retirement side. But how do you begin to drive engagement? Because it's about awareness, making individuals aware of what they need to do, and then that they need to follow through on the next step. So how do you get the engagement?
Yeah, offering education on a broad range of topics is one of the keys to success. So my challenge yesterday may have been budgeting. And so I might have gone out to my employer or to my retirement plan or my other investing account because I knew they had some financial wellness resources for me. I may have looked at some information to help me on my budgeting challenge. And I would have seen that there's other information there as well. And that's particularly true again, because we're leveraging a personalization engine to raise up education that we think is going to be most relevant for somebody. So I know that resource is available to me. So tomorrow, if my needs are on healthcare and I need to start thinking about a new healthcare challenge in my household, I know that resource will be available to me. And that's one of the ways we drive engagement. We want to see those return visits. We want to see individuals coming in and addressing again all of their financial challenges. The other piece that's really core to our solution is gamification. It's really we see a significant increase in the amount of time that individuals spend on wellness when quizzes are offered. People like to be challenged. They like to take quizzes. They like to see how they're doing compared to others. And that's really something that we've seen a lot of success in driving engagement. And then the third thing I'll mention is personalized email campaigns. We've seen a lot of success here as well in being able to reach out to specific demographics of individuals. So it's not an email that we just send out to everybody. It's targeted to meet the needs of a very specific audience. We send a targeted email to them, draw them in with education. And with those types of campaigns, we see open rates over 60%. So a lot of success in not only engaging people when they're in the financial wellness experience, but using those personalized emails to bring them in and encourage those return visits.
So Ron, my last question to both you and Alicia, I'll start with you. How do you measure success? So, anytime you roll out a new product or new service, you got to have a benchmark. So how do you benchmark that the program is successful? Is it just interaction or is it more than that?
We measure success in the following way. One is we look at the number of illustrations that are run on an annual basis. And right now we run approximately 40 million illustrations. But in terms of measuring success, it can't be just the number of illustrations you run. The question becomes, just because you run those illustrations, are people actually taking action? And what we've found, I'll use the 401k industry as an example. Individuals that actually go through a simple process of calculating both the life expectancy and the healthcare costs increase contributions. Participants increase contributions by over 20%. And then the firms start looking, the record keepers start looking at that and saying, we need more people to run these illustrations because people, when they see those numbers, they take action. And advisors, in terms of investments, when they're working with clients, the close ratio is very high, and that's something we also measure. And the investment to address healthcare in a lump sum usually ranges between close to $100,000 to over $160,000. And people are more than willing to take that action in order to get healthcare off the table. And that's how we measure success.
Alicia, same question for you. And I know you did share, the open rates, the engagement, but how do you, from your perspective, how do you measure program success?
Yeah, a lot of it, it's all of those things. It's return visits, but we're also looking at the success of calls to action. Ultimately, education by itself is great and it's needed, but we want to drive the individual to the next best step. And so we're looking to bring them into something that's going to help them. It's going to improve on an outcome. It's going to get them more information. And so we track, we report on those, and we give real-time data back to our clients on those. So success for us, it's really helping individuals understand what their healthcare costs could look like based on their household situation. It's giving individuals opportunities to plan for, feel more empowered over their finances, whatever those challenges are, which of course includes healthcare costs. So it's a lot of different elements that factor up to show success.
Yeah, and it also depends on the demography, the demographics of each employee population. It varies from the firm and within each industry. Alicia, Ron, we're going to have to leave it there. Great conversation. Great to see you. And thanks for joining us. We look forward to having you back on the program again on another date.
Thank you.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, at our website. And we're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe. Keep on saving. And don't forget, roll with the changes.